I'm Abhik, Communication Officer, IDSP. Today we have Dr. Sanket Kulkarni with us, Joint Director, IDSP-NCDC. Hello sir, welcome to the show.
Thank you.
Sir, first of all, we would like to know what are the primary causes and modes of transmission of seasonal influenza and how an individual can protect themselves.
Seasonal influenza is an illness of viral disease which is mainly caused by orthomyxovirus,
Okay.
known as influenza virus commonly, or flu-like symptoms, which is mainly spread by the airborne or the respiratory route. So it transmits from one person to another person, from the aerosols of the infected persons to the healthy person. So not only during the frequent direct contact between the persons, but also an indirect contact is also a mode of transmission, which is caused mainly due to the other innate objects like the table, the chair, or the handles, etc. When the infected person touches his nose and touches those articles, similarly, if the healthy person touches those infected materials, he can get infected. So what are the symptoms of this seasonal influenza? One has to understand the prevention aspect. So the symptoms are mainly the fever, cough, sore throat. Fever is also around more than 38 degrees something. So it is almost we have a symptoms in the past 10 days. If the patient is having or in contact with the direct infected person, then he might be possibly or likelihood of getting that seasonal influenza infection. So what are the modes of prevention in this aspect? The modes are very, very essential. The main contact of this one is from the infected person to the healthy person is the direct contact. So you must maintain at least a 2 feet distance between the infected and the healthy person. If someone is coughing or sneezing in the public, just cover your nose or cover nose or mouth with a kerchief or something, or turn your neck beside, so that you don't come directly in contact with the aerosols that are secreted by the infected person. Or frequent hand washing. This is very common. Not only prevents the seasonal influenza virus, but also the other viral infections such as COVID-19, etc. So frequent hand washing with soap and water will kill the virus, because since it is an enveloped virus, with the soap and water, the simple technique of using the soap and water, actually it destroys the envelope around the virus and makes it ineffective. So these are some very easy methods of preventing the seasonal influenza virus.
Sir, which group of people are considered to be most vulnerable to such complications from the flu, and why?
Seasonal influenza, as you know, affects all the age groups. That is, it infects from the child to the most elderly patients. Most vulnerable groups among them are usually less than 10 years and more than 60 years. That is, extremes of ages are most vulnerable for the development of the complications. What kind of but when you see, both males and females are affected equally, all the age groups are affected, but the complications are usually more among these age groups, because you can call lack of immunity or their ability to fight against the virus is little bit deprived in the extreme age group, because it is not developed in the younger and it is almost in the waning stage in the elderly. So these kind of things will cause complications. What type of complications you expect is like for full-blown pneumonia. That is, sometimes this pneumonia also causes the consolidation of the lungs and leads to breathlessness. So these complications will lead to tightness in the chest, sometimes chest pain, some pricking pain, etc., which may also cause the effusion in the lungs. That is a collection of liquid in the lung and the other surfaces. So this will lead to what you call breathlessness and heaviness in the chest, which leads to other complications like the patient requires oxygen from the hospital, or external oxygen is required, and it may needs additional attention like drawing of the fluid from the pleural space, or it may also lead to some secondary added bacterial infection which may cause further complications. Especially what we see is among the comorbidities such as diabetes and hypertension, these patients are likely to get more complications than the normal healthy individuals. It doesn't mean that the healthy individuals does not get complicated. They too, we have seen that they too experience the severity of this infection, and sometimes they also succumb to the infection. So one has to be very careful with this disease.
Sir, how can one differentiate seasonal influenza from other respiratory diseases like COVID-19, asthma, etc.?
As I said, seasonal influenza and other respiratory illnesses, it is a little bit hard to differentiate clinically because majority of them do present in the similar way with fever, cough, sore throat, etc. However, if you collect, because now we have the laboratories which have been enhanced their capacities for diagnosing both COVID-19 as well as influenza. But now, with the onset of other laboratory techniques wherein multiplex kits are coming in, we also have diagnosis of RSV in that. So once we do, we come to know laboratory diagnosis. We take the either oropharyngeal swab or the nasal swab, and once we do the RT-PCR, we get to know exactly the influenza, or whether it is influenza or some other virus which is infecting during that time. But during the season, actually India faces two seasons, two peaks in a year. One in the month of Jan to March, that's a winter season, that we see a rise in the trend of influenza cases. Second is the post monsoon season. So during this period, it is most likely that we may get the influenza disease, and other times we may think of the other diseases. Second thing is, what we have seen in the last few years is from 2020 onwards, the Yamagata strain of the influenza B is not circulating in not only India, in the entire globe. So we may expect either influenza A or influenza B Victoria strain. As of now in India, during this winter season, what we are seeing, there is a slight rise in the Victoria strain, that is the influenza B Victoria strain, which is rising. This is a mild infection, however, it causes a similar illness, that is fever, etc. And it may cause complications, but the complications, especially with respect to the other virus, that is influenza, is lesser.
One last question, sir. What steps should someone take if they suspect they have the flu, and when they should seek the medical attention?
Nice question. One has to understand that once he is infected with any kind of flu or flu-like symptoms, first of all, he has to get himself such a way that cover nose and mouth, so that his infection is not transmitted to the other family members, especially the vulnerables like children and the elderly in the family. So what he can do, he can wear a simple mask or a simple cloth which can be used at the home, as well as frequent hand washing at the home is very essential. So before he touches anything, if he starts washing his hands and clean his environment, it will be very good that he may not transmit the infection to others. However, for himself, what he has to do is, if he is having a very high grade fever continuously, or there is a little bit onset of breathlessness, or if there is any signs and symptoms which makes him that he has to go to the hospital, he has to kindly contact the physician or a doctor at the medical health facility, so that he or she is not in a phase that is complicated enough so that he cannot recover. So that is very essential. So one has to understand, as soon as he gets the symptom, it is better to contact a physician and not to administer a drug at home himself. That is very essential. Otherwise, what happens, he may develop the complications and he may not know that he has developed the complication, and he has not been in contact with the physician. And at the last moment, if he goes to the hospital, it will be little bit difficult for the physician to treat the case in that aspect. However, having said that, the complications are less with respect to influenza, and the mortality is also very, very less. However, the mortality may increase if the treatment is not initiated in the due span of the infection.
Sir, thank you so much for sharing such wonderful knowledge and information with us. So in our next episode, we'll have one more expert with us from the healthcare industry. And stay tuned, guys. Keep sharing and subscribing this channel. Thank you so much, everyone.